What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
I'm great. How are you? How are you, everybody? We're going to talk today about something that affects, most older people, actually. We're going to talk about diverticular disease, and this is broken down into something called diverticulosis and diverticulitis.
Awesome.
And so those are, pretty strange sounding names, but
Yeah.
diverticular are really, it just talks about the location of where this disorder is. Diverticulum are just like the segments of the large intestine. You can think about them that way. So diverticulosis is kind of a disease separate from diverticulitis in that it is the pooching out of these segments of the diverticula. So you get these little pouches along the segments there, and then diverticulitis, anytime you have a medical term with itis on it, just basically means inflammation in that area. So then these little pouches become inflamed. And that kind of tells you about just knowing that what's more possibly harmful, right? And of course, it's the inflammatory aspect of diverticulitis, because a lot of people can get diverticulosis and never know it.
So this is specific to the large intestine?
Yeah.
It's not, okay.
Yeah, it's specific to the large intestine. And the area that's most affected is the sigmoid colon, actually. So that's the that's on the
end, right?
Yeah, that's the end. That's on the left side. So, on your lower abdomen, like about the left side of the sigmoid colon comes down and attaches into the rectum and stuff like that. That seems to be the biggest area. But, more than half the people over 70 years of age have diverticulosis.
Oh, wow.
And then that increases up to like 67. What would it be? 67%, 70% once you get over the age of 85. And they're not really sure why people get this. I mean, one of the main leading theories, and it has some research backing it up, is basically constipation. Kind of makes sense from a common sense perspective, right? Like if you're not moving your bowels and they're sitting and you have stool sitting in your intestines or sigmoid colon, you create a lot of pressure there, which can create these out pockets or pooches or whatever within the diverticulum. So you get this diverticulosis. You need to keep things moving along. So that has a lot to do with treatment and prevention.
Are these palpable masses, Keoni? Do you know? Like, could you
No,
feel
typically you're not going to be able to feel them on an abdominal exam at all.
Okay.
And probably the best way to diagnose this is through a colonoscopy.
Okay.
Where you can actually see that. But you can also, the imaging is going to be a definitive diagnosis, but also there's a lot of signs and symptoms that can also help people.
Yeah, it's interesting. I've yet to see this clinically, and I haven't seen it in an older person. The two cases that I've heard of have both been UFC fighters, and it comes from them trying to go up a weight class. And so they talk about like eating so much, and then they get diverticulitis. I've heard of that for two instances. Specific with those fighters.
And you bring up a good point, because a lot of people will get an attack of diverticulitis based on after eating a meal. They'll get an attack, or they eat too much or something like that. So again, that talks a little bit about prevention and treatment, right? Like chewing your food thoroughly, like making sure that when you sit down and eat, you're in parasympathetic mode instead of sympathetic mode, that can help with prevention. Anyway,
so if a person has diverticulitis or diverticulosis, when they eat, it's going to increase their symptoms?
Not always.
Okay.
But a lot of times when people eat, or they're stressed out, or they're not relaxed, or don't chew their food enough, it can bring on diverticulitis.
Okay.
Right. Diverticulosis is usually a benign thing as long as the bowels keep moving. And how do you keep the bowels moving is making sure you're drinking plenty of water and having a lot of fiber and not being constipated. By the way, our podcast number 15, Wellman's Podcast, was the constipation podcast. you guys check that out, because that will go into a lot of what you can do for constipation.
100 episodes back.
Yeah, right. I know, it's hard to believe. But diverticulitis is basically, you can think about it, when you have it acutely, and the bad symptoms, it's basically those pockets are inflamed and are infected. And that's serious. That can be life-threatening. So, it's basically trying to keep the inflammation down and any infection down would be good. But a good way to help this is just make sure you're having a high fiber diet. If you have the symptoms, if you have like a mild case or like uncomfortable case of diverticulitis, then you want to eat easily digestible foods, maybe even a liquid diet, possibly even fast. And so a lot of times that can help. And a lot of times, most time when you get a bout of diverticulitis, it passes. Like you'll have it and you may be really, really uncomfortable for like a couple hours or whatever, or for that day. And then it goes away. Most of the time it resolves on its own.
So this could be something that could come and go within 24 to 48 hours and be more chronic.
Oh yeah. Okay. Yeah. It's just when you get the acute attack, there's a lot of complications that can happen. For one, would be that you have a perforation in the intestine, and that's a big deal. That's life-threatening.
Yeah.
And that can certainly happen with that. So it's not something, like it's kind of, I basically don't want to tell people, well, if you get an attack, just wait it out and see. Right. It really depends on how uncomfortable you are, because if that's that's an emergency situation.
Yeah, right? Absolutely.
So and then speaking of the, diverticulitis, this can really mimic a lot of other things, like irritable bowel syndrome, right? So it can be mistaken with that. Again, the definitive diagnosis is imaging, but you can get an idea of symptomology. I mean, most of the time, irritable bowel syndrome, there's a big stress component, and there may not be a whole lot of, it could be uncomfortable, but it may not be excruciating pain like you would in an acute attack of diverticulitis.
Okay.
Another thing that it could, be confused with is appendicitis. So appendicitis is something that needs to be looked into. And, if you have an appendix, just like if you have a diverticula that's getting ready to burst, that's an emergency, life-threatening situation.
Right.
The thing with appendicitis is it occurs mostly in younger people. But again, there's no fine line. I mean, if you're young, you could still have diverticulitis. It's just more prevalent in older people.
And the appendix would typically be on the other side, like as opposed to that sigmoid colon region.
Yeah, and typically it's the discomfort's on the left side where the sigmoid colon is. But again, diverticulitis, there's no hard fast rules, because it can mimic appendicitis. And appendicitis, actually, when you have it, you show up pain anywhere.
Yeah.
So. But typically we think, a lot of it comes on from, the American lifestyle, like the foods, low fiber diet. That this is what some researchers think that it comes on. Chronic constipation can bring it on, that type of thing. One other thing I will say, there's no definitive research on having diverticulitis or diverticulosis and the increased risk of colon cancer, like there is with having colon polyps. Those seem to increase your risk of possible colon cancer. However, it also, in theory at least, if you're chronically inflamed, then that, in theory, although we don't have a lot of research on it, that's going to also increase your risk of cancer.
Yeah.
So we talked a little bit about the symptoms, but other symptoms are like you can get fever, you can get nausea, you can get vomiting. It could swing between diarrhea and constipation. You get chills, that type of thing. It can mimic appendicitis, ovarian cysts, an ulcer, any type of IBS, Crohn's disease, anything like that. So you need imaging to help with that.
Okay. And so imaging is the gold standard for making the diagnosis overall.
Right.
Yeah.
Right. Or just doing a colonoscopy and directly looking. But most people with diverticulosis will never, experience any symptoms. So as you get older, most people have this. So that's a good thing. So most of us probably have that.
So what do you do about it?
Diverticulitis? Well, the main thing is with diverticulosis, making sure that your bowels are moving. A high fiber diet, plenty of water, chewing your food. Like that's the main thing to prevent attacks, and to make sure that your large intestine stays healthy and its integrity stays intact and doesn't get worse.
Yeah.
So it's like making sure that's, as naturopaths and really all primary care physicians should be doing this is, that's a question that should always be asked. Like, are you having regular bowel movements? Is it difficult to pass? Are you putting a lot of pressure on your bowels, like straining, on the toilet, because that can make it worse. That can increase it. One thing they used to say also, and this is not true, this is a myth, and they even told me this in medical school, is people with diverticulosis should not be eating seeds or nuts or anything like that. And in my opinion, it was the wrong advice. It just made things worse. The whole thought was that these seeds or nuts or food particles would get caught in these little pouches and then sit there and kind of rot and create a microbial, flora mess there that kind of festers and then creates diverticulitis. So anyway, I tell people that that's not something to worry about. You should be eating high fiber foods, but make sure you're drinking plenty of water and stuff like that.
So typically when you're seeing this clinically, Keoni, it's someone who's dealing with this a little bit more chronically. Is that the case?
Typically when I see it, it's people that have had attacks.
Okay.
Yeah. And had a number of attacks. And a lot of times it doesn't get diagnosed until after a few attacks when the docs actually look a little bit further.
Right.
Because a lot of times it'll just resolve and people are like, I don't know what that was, but I feel fine now. I don't need to go to the doctor. So a lot of times it's like when you have a bad attack and you find yourself in the ER and then it gets diagnosed, because they do extra imaging and stuff. But things you can see on like blood labs with diverticulitis is you may see, if you have an infection there, you may see an increase in white blood cells, right?
Mm-hmm.
I mean, if it's been going on for a long time, then you may see low white blood cell count. But typically with an acute infection, the white blood cell count is going to go up.
Right.
And then, again, that with inflammation, my favorite thing to check for inflammation is looking for C-reactive protein. It's a great marker of inflammation. So typically people have that elevated. And then just from the trauma of, the constant irritation in the large intestine, there may be microbleeds in there and you may see anemia, and this can be especially true in elderly patients. So the anemia needs to be addressed too. So a lot of people will have symptoms that look like, fatigue, I just don't feel well. But when you look at a blood lab, you can see, their red RBCs down, their hematocrit down, other markers down. So typically they may have anemia too, which needs to be addressed. But the best way to prevent any of this is like high fiber diet. And what is that? What is a high fiber diet? The stereotypical American, I think we talked about this on the podcast. It's like, 5 to 10 grams of fiber? You're doing pretty good if you get 10 grams of fiber.
Wow.
Now contrast that with our ancient ancestors who got between 50 and 100 grams of fiber. So this to me is really a disease of the modern day. I don't know that for sure, but it seems like it is because of the strong fiber component.
Right. Which makes the no nuts and seeds part even funnier.
Right. It does. Like that's a complete myth that has been dispelled just only recently, So I would say at least 35 grams, 30 to 35 grams of fiber a day, more if you can. It's not that hard to get, especially if you're eating a high plant-based diet. It's really not. And then the other thing about older, go ahead.
If someone who you're seeing, Keoni, is having trouble getting that 35 grams, what type of things do you recommend that they do to improve that?
Fiber supplement.
Okay.
Typically a fiber supplement, both with soluble and insoluble. And we did a podcast, I think, on that. I don't know the number, but we did I think we did one on fiber specifically. But fiber just gets things moving. And, you know, the older we get, we also lose our thirst mechanism. So, you know, with fiber, you need to drink plenty of water to keep the bowels moving. Mm-hmm. So water is huge. Let's see. I think, here's a study, you know, just talking about the low fiber diet. You know, there 47,000 healthy adults followed an average for 11 years, 12 years, highest fiber intake, greater than 25 grams a day, or 41% less likely to be hospitalized for diverticular disease compared to those with the lowest intake, which was less than 14 grams a day. So that's pretty good. That, you know, the other thing is one thing that gets the bowels moving. Again, this goes back to our constipation podcast, is sedentary lifestyle. Like, right. You know, motion is lotion.
Yeah.
Get those bowels lubed up, move.
Yeah.
Another risk factor is, of course, obesity and smoking. There may be some indication of alcohol causing a problem too with acute diverticulitis. It seems like people, you know, alcohol consumption just increases your risk.
That's a weird one to me. I'm not sure how that works.
Yeah, that's a weird one to me too. I'm not really sure. I could kind of see, like, if you're taking a lot of NSAIDs and you're in a lot of pain and it takes the issue, that may increase your bleeding risk. You know, you may have that may exacerbate any anemia due to the diverticulitis.
Right.
But these things also seem to increase your risk. Aspirin, NSAIDs, you know, what else would, like opioids, right? Opioids slow the bowel down.
Absolutely.
That may certainly increase your risk. I mean, I've had a lot of patients come through just severely constipated on some of these medications. So any medication that makes you constipated could certainly do that.
So a lot of the prevention treatments and like what we would suggest to people makes a lot of sense to me. But if you go to the hospital and you're diagnosed with diverticulitis, what do they do there?
So think about what's happening here. So if you have diverticulitis, you are probably fighting some sort of an infection, right? The gut flora is out of balance. Okay. That speaks to treatment, both conventionally and unconventionally, or natural treatment. But conventionally, if the gut flora is out of balance and it looks like you have an infection, high white blood cells, what are they going to do? They're probably going to give you some sort of antibiotic.
Right. Okay.
All right.
So it's really clearing up that infection and then going to those preventative measures that we just discussed.
Right. And if it's, you know, for any complications, you may get an IV drip, antibiotics, and worst case scenario, you may require surgery. Okay. You know, you may, the other thing is you may get some sort of, what is it called? I think, if I'm not mistaken, I think steroids may, just to help keep the inflammation down, may also be used. But typically it's antibiotics, it's fluids, waiting to see if it passes. If it passes, then, you know, surgery is not going to be required.
Right.
Yeah.
How long do you know, Keoni, how long they would give, like it passes? Does that mean no past alleviation of those symptoms? Your bowels are moving again, like you have a bowel movement?
A typical patient may go in with a severe pain, right? They may go in with a fever. And typically what you're going to do is just monitor them to see that the pain starts going away and that the fever starts coming down, you know, and that they're not in severe distress. That's typically how you just monitor them to just make sure that it passes. And typically it will. It will.
Yeah. Do you know how often people need a surgical intervention? Is that common at all?
It's not common. It's rare, but you know, it's absolutely necessary, especially if you have a rupture of any sort.
Yeah.
It's rare, but you know, anybody who's had an attack of this, the way it feels, they're gonna really be really aware and about their habits and really trying to prevent anything like this from happening again.
Mm-hmm.
And speaking of that, the other thing that can mimic this is if you've had any type of bowel surgery or anything, some people will get excessive scarring there, and that can show up as diverticulitis too, where you get obstruction, bowel obstruction. It's not necessarily the same thing, but again, that it can mimic this.
Right.
And so it's the same approach. Like you wait and see if it passes, and make sure that the person who has this is doing okay.
Yeah. Well, it seems like it's tough for people to judge. It's really, because I mean, all you know is you're having some sort of belly pain, more or less, which could just fall into so many different categories.
Right. The main antibiotic of choice is rifaximin. It has a good safety profile. It has some research specifically for diverticulitis. All right. There's and then as an anti-inflammatory, you can think of it's more of a topical anti-inflammatory. They take it orally is something called Azicol or mesalamine. It's used for acute diverticulitis also, and found that the response is pretty good in people receiving this versus placebo. And what it does is it doesn't break down the gut. It basically coats the bowel. It gets to the bowel and coats it, and just brings down some inflammation. So that's pretty much the conventional treatment. There is a stool test that may give you an idea if you're having it, that you may not need imaging, that has some research called the fecal calprotectin test. Anyway, it's a non-invasive stool test, and it's kind of like a biomarker for diverticular disease.
Okay.
So, just so people know, calprotectin is a protein released by white blood cells during inflammation, and it seems to be more persistent in the bowel. That's why they call it fecal calprotectin. Anyway, it may indicate, based on your levels of that, reoccurrence, and may help with diagnosis. So we talked about the conventional side of it, how we go about it, and there's a lot of overlap with natural treatments there. But let's go into more detail with the natural stuff.
All right.
Because this is where a lot of conventional docs just don't even talk about this.
Right.
So we talked about the risk factor: smoking, alcohol. We talked about, sedentary lifestyle, physical activity, maintaining a healthy weight, all the stuff that we know to be helpful. We dispelled the myth about, not eating nuts or popcorn or anything that has high fiber, because it can get trapped in diverticula. That's just has not borne out with research. So that's not an issue. And in fact, I would think it would help, right? Because most of those are high fiber foods, as long as you're drinking plenty of water. We do know that plant-based diets, especially where the intestines are involved, more vegetarian-based diets are very protective and very good for the bowel, small intestine and large intestine. So plant-based diets that are high in fiber, and plant-based diets, if you do it right, are usually high in fiber. So vegetarians kind of have a leg up on this one with most of us. Here's where you want to have a low fiber diet though. If you have an acute attack, right? You probably don't want to do a lot of high fiber. You probably want to do like easily digestible foods during an acute attack. Liquid-based diets, maybe fast. All right. So that's a treatment for an acute attack.
Right.
All right. But other interventions. So since we know that there's a big, strong inflammatory component, diverticulitis, itis being inflammation, well, there's a ton of good anti-inflammatory herbs out there, and we've talked about a lot of them. One of them is curcumin. Another one is another nutraceutical, not an herb, but it's fish oil or basil. So you can take that, and those things you can take on a regular basis to help keep the inflammatory component down.
Right.
We also know that in those pockets, it seems like the gut flora gets messed up and you get more of these negative bugs around. So how can you address that? Well, you can certainly address that with probiotics. Okay, so you can restore balance of the intestinal flora, and this may also reduce inflammation. And then think about, okay, well, is the gut integrity messed up there? So a lot of times the gut integrity is messed up. Once the gut integrity, the mucosa is messed up, what happens? The gut flora gets messed up. Well, to address the mucosa of the large intestine, sigmoid colon, there are a number of things you can do. Butyrate is one of them. Butyrate is found in high amounts in butter. You can find it as a supplement. This is basically food for your gastrointestinal mucosal cells to help them repair themselves, and it's also food for your gut flora, your good gut flora. Then you can also think about mucilaginous herbs like slippery elm or marshmallow root. These things help coat the intestines. Glutamine is amino acid that's food for the gut. Again, this can help heal the gut. Another thing you can do just to aid in your digestion is take a digestive enzyme.
Mm-hmm.
A lot of older people, as you know, Brian, don't have their gallbladders anymore. So just a little caveat on that is, if you don't have your gallbladder, you should probably take a complete digestive enzyme, one that has bile salts in it. One that has, a lot of people also are on acid blockers. Well, over the long term, that's not going to help. That's certainly not going to help diverticulosis or litis, right? Because what will that do? That will inhibit downstream secretion of enzymes and will inhibit digestion. And if you take acid out of the equation in your stomach on a daily basis, now you're more prone to GI infections. It ruins the gut flora balance. Or you take in food that has some bugs in there that are gonna infect you, where the stomach acid's not there to kill it. Right. So a lot of times we eat stuff that's not great for us, but our stomach acid destroys it.
Yeah.
So it's anything you're doing further, at the beginning of the digestive tract, including chewing your food thoroughly, right? And from that point on down, sitting and relaxing while you're eating. So we talked about the anti-inflammatories. We talked about restoring the mucosa with mucilaginous herbs, glutamine, that type of thing. Feeding our gut bugs healthy things like fiber, butyrate, feeding our gut cells with healthy things. And what else? Oh, and by the way, since the standard treatment for diverticulitis, conventional treatment, is an antibiotic, you need to be on probiotics at least anyway, long after you're put on a antibiotic. And I typically tell people, Brian, like 1 to 2 months on a probiotic after an antibiotic, and at least 25 to 30 billion CFU per day. CFU is just the designation of it stands for colony forming units. That's the designation on the bottle for probiotics.
So a month or two after a probiotic or an antibiotic.
Yep. I'm just trying to think of other mucilaginous herbs that can help. Like any type of fiber that's soluble. So that's like psyllium seeds, flax seeds, slippery elm. We didn't mention that. Licorice root. By the way, licorice root is also antimicrobial. Okay, so if we want to have a natural antibiotic on, which we can, for most of the time, unlike conventional antibiotics, there are a number of things to think about. Garlic would be one, would help keep gut flora in balance. Ginger would be another one. A lot of your spices. Licorice root would be one. There's an herb called golden seal that may help also. So you can address this from a natural point of view, and I think the best approach is a combination of two, especially when you're in acute distress with diverticulitis. I'm trying to think, is there anything else we want to talk about? I think we've hit everything.
Move, drink your water.
Yeah, move.
That's what I come to the conversation with.
That's the main thing. That's certainly the main thing. And I guess I'd also want to say, like, if you're one of these people that every now and then gets like severe gut distress and then it passes, I don't think that's something you should ignore. I think you should at least go get it checked out.
Okay.
And it'd be best to get it checked out or followed up on when you feel good, instead of being rushed to the emergency room when you don't. Yeah.
Yeah.
Or at least let your doctor know what's going on. In a lot of cases, it could be easily taken care of because it's with lifestyle stuff. If you just know what you're dealing with.
Right. How often do you see this? And I did want to ask about the mucilaginous. Is that more or less like they just make the lining more slippery? Because it seems like there were two types of herbs that helped kind of heal the gut.
Mm-hmm.
And then there was the mucilaginous ones that were just making it more slippery. Is that correct?
Okay, yes, you're
layman?
right. They make it more slippery. You can think about helping moving things along, but really what it does is it helps rebuild the gut mucosa, the intestinal mucosa. So therefore, what it will do if you do that, it protects against infection and injury. It's soothing to the irritation, right? It promotes tissue healing, and all of that can prevent reoccurrence.
Okay. Okay.
That.
So
But
I
yes,
shouldn't be separating them.
not necessarily, but I separate them and saying, yeah, like a good way to think about mucilaginous herbs is like coating the gut mucosa to help move things along and to help heal the gut wall.
Yeah. Okay.
Yeah. So, what else? I think that is it. There's a lot of GI stuff that will mimic this, but typically the hardest one is distinction between IBS and this, I think. But there's so many things. I think a DDX, like if you're seeing this, you want to be able to rule out definitely hepatitis. You want to, of course, appendicitis would be one. What's that?
I got it. Differential diagnosis.
Yeah, differential diagnosis, like the things you're thinking about as a clinician. I'm sorry. Yeah.
Yep. Yeah.
So I would say definitely appendicitis. I would say maybe pancreatitis also would be one. Definitely IBS. Any of the like Crohn's, any of the gut stuff, Crohn's disease, ulcerative colitis. What else?
Yeah, I mean, any genitourinary system thing, it seems like, would just need to be screened.
Yeah. Yes. I mean, it's good to get a full screening on that. And most of the cases I've seen, like with blood labs, I've seen anemia in quite a bit of these cases, which, can make you feel absolutely completely awful because especially if you're severely anemic.
Right. And now, so how long when you see someone, Keoni, do they typically not have a flare up after following these preventative measures, or is this something that they consistently kind of monitor and deal with?
If you've been diagnosed with diverticulosis, you're not out of the woods as far as not having a flare up. However, you significantly decrease your risk by following some of these lifestyle things that we talked about, and maybe doing some of these nutraceutical interventions that we talked about.
Okay. Yeah.
Like I said, most people don't even know they had diverticulosis, never had diverticulitis, never had an attack, and they go about their lives. And I would say most Americans have diverticulosis, especially when you get older. What were we talking about? Like 70 to 80% of Americans have it at the age of once you get in your 80s.
Wow.
So
all the more reason to stay moving and grooving.
Right. And all the more reason when you have to be on an antibiotic to always take your probiotics, like really take care of your gut health.
Yeah.
I mean, the expert on this, we've had her on is Jillian. So, maybe we can have her come on and talk about more specific things that she talks about. But this is the way I approach it.
Yeah. Awesome.
Yeah.
Happy gut health.
Yeah. Happy gut health. Hey, it's the root cause, could be the root cause of disease. It is the root cause of disease. Always check the gut first.
All right, everybody. Thank you for listening. We'll talk with you next week.
Take care, everybody.